Throughout the COVID-19 pandemic, AdventHealth has kept its Keep Me Safe service standard at the forefront of all the decisions we have made. From being one of the first in the region to postpone elective surgeries and procedures, to now being able to test our entire team members and implement safety precautions in order for patients to come back and receive all the care they've come to know and trust us for. It has been a journey that has been full of opportunities to make sure we are doing right by the people who trust us. Today, we're sharing some of the steps we have taken in order to safely reopen our doors with our community partners, people we rely on both personally and professionally in each of our lives. It is my privilege to introduce you to our Chief Medical Officer, Dr. Teresa Herbert, who will share all of the steps we have taken and some information that may be helpful to you.
The stay-at-home order has done a tremendous job of reducing the transmission of COVID-19 disease in our community. As a result, we have had time to put in place new procedures to keep us safe. It is safe to go back to work right now, providing you follow these new processes. The new processes include social distancing, hand washing, rigorous attention to cleaning in the workspaces, the use of masks, and a screening of all employees for signs of illness. COVID-19 will not die out until we have an effective vaccine or herd immunity, where a large number of the population have had the infection and are now immune. With that in mind, I would like to talk to you about ways to keep your employees safe going forward. AdventHealth has taken a number of precautions to make it safe for our employees, our physicians, and our patients to return to our facilities. These include universal masking. That means everybody in our facilities, patients and staff, are given a mask for all interactions. We know that masks help prevent the spread of disease. We also do door screening, which means everybody coming into any of our facilities have a temperature check and are asked a number of questions regarding their health on that day. That screening happens every single day. The screening is done at the door and temperatures are taken and questions are asked regarding the person's health on that day. The following day they come in and we do the same screening process because we know symptoms can develop quickly and situations can change overnight. Social distancing is a really important part of keeping your staff and your clients safe. This means keeping 6 feet apart, spacing out your waiting areas with less furniture so people are not crowded in on top of each other, looking at your cafeteria facilities, for example, to make sure that tables are spaced adequately. It's important that you have signage in place to remind people about the social distancing. We're social animals. We like to crowd up and get close and share information and laugh and joke. In our facility, we resorted to duct tape on the floor with 6 feet measures until we got the correct signage in place. The duct tape was very effective and gave people a sense of comfort that they knew they were safe if they stayed on their markers. So it sounds simple, but it really does work. In our facilities, we pay particular attention to cleaning. We do terminal cleaning after every patient encounter. That means we use an FDA-approved virucidal spray on hard surfaces and high-use surfaces such as door handles, bed rails, equipment that's used on patients. And we make sure that we observe the correct wet time for those sprays. If you start to use different products in your facilities, make sure you understand the effective time that spray has to be in place. It can be from 1 to 5 minutes that the spray has to rest on the surface to kill all of the viruses. We know that up to 25% of infections may be asymptomatic. That means you can have the illness and have no symptoms at all, but unfortunately you can be spreading them to those around you. We have implemented a testing program in all of our AdventHealth facilities where we have screened all 1,200 of our employees the first go round to see what the infection rate is. I'm happy to report right now that our infection rate among our asymptomatic employees has been very low, but we will do ongoing screening based on advice from epidemiologists about the frequency at which that needs to happen. Employee testing is a challenging issue. Because the rate of asymptomatic carrier state in this community is currently quite low, you will be running a lot of tests with results that come back negative. What you're looking for is that one person who may inadvertently spread the disease to the whole production line. There is a cost associated with testing, both in terms of financial and lost time for workers. So it's a matter that has to be approached quite delicately. For symptomatic workers, people who have symptoms of cough, fever, chills, nausea, vomiting, those people should definitely be sent home from work and sent to get tested. The testing arena right now is the Wild West, with many companies jumping on board and offering to sell testing kits and have not been validated and do not do what they say to do. The false positive rates and false negative rates in these test kits make them incredibly unreliable and possibly dangerous. If you are told that you have antibodies and that information is incorrect, you may inadvertently expose yourself to disease. My recommendation is that we rely on the laboratory controlled tests for now. At some point in the future, we will have some accurate point-of-care rapid tests available to all of us, and that will make life much easier. But until that time, be really cautious about investing in any of these products. It's quite likely, as we return to work and start to loosen up some of the restrictions, that we will see more cases of COVID-19 in our counties. Because of the time we've had to prepare, we feel ready to deal with an increase in the number of cases. The area hospitals have sufficient capacity in their emergency departments, in their ICUs. Their ventilator capacities are sufficient should we experience a surge. If we were to experience a bad surge, we may have to back off and go back to a more restricted way of doing business. But rest assured that we are ready to get back to work.
AdventHealth Hendersonville understands the importance of keeping your employees and customers safe. We want you to know we're here to provide whole person care, body, mind, and spirit. As Dr. Herbert showed you, we've taken extensive steps to keep everyone safe who comes to us for care. If you or one of your employees is in need of health care, you may reach out and schedule a traditional or telehealth appointment by contacting your AdventHealth provider or calling our patient resource team at 855-774-5433. You may have access to either the telehealth or in-person traditional visits, whether you're an existing patient with one of our providers or you're a new patient. Simply call and connect today. If you would like to learn more about AdventHealth and its workforce healthcare options, please contact Jeremy Wild at 828-606-7851. Thank you for your commitment to our community, and please know that at AdventHealth, nothing is more important to us than you.